They said it was for our safety. But safety became silence. And silence became betrayal. I was there, masked, monitored, and unfairly dismissed. And I documented everything.
Faith was tested, accepted, yet also denied.
They called it care. But it was blind compliance, masked as medicine.
Healthcare organizations didn't just enforce vaccination, they were paid to. Medicare and Medicaid tied reimbursement to staff compliance. Healthcare facilities reported flu shot rates to secure federal funding. And consent became currency in a system built to reward obedience. This wasn't about immunity. It was about metrics, about funding, about control.
When the mandates were questioned, they refused to listen. They ran from accountability, transparency, and the oath they claimed to uphold.
He followed orders, but he watched a religious exemption denied. Then came the research. What they were doing crossed the line of legality.
Behind closed doors, healthcare executives masked their faces, but not their intent. Staff compliance was tracked, published, and monetized. Dissent was silenced. Exemptions denied. The mandates were enforced. The metrics achieved. Reimbursement secured. And behind the masks, the corporation smiled. Not for health, but for profit. Medical mandates broke the law. Healthcare facilities passed off legal responsibility. Corporations failed to obtain informed consent. Local governments ignored constituents. Coercion forced compliance. Government agencies failed to protect workers. The vault of truth was opened, but ignored. Now the lawmakers sit to answer or to evade.
We masked up. We watched exemptions denied, colleagues fired, and consent erased. We were told it was for safety, but it felt like control. And when refusal meant termination, that wasn't policy. That was coercion. That was labor trafficking. We didn't sign up to be silenced or used for profit. We signed up to care, and now we're speaking up. Let's remove the scarlet letter. We need a medical battery law. One that protects consent and ends coercion. One that holds institutions accountable.
Todd Michael Chellen's memoir, Betrayed by Big Med, recounts his personal and legal struggle against healthcare mandates on flu vaccination and mask wearing, highlighting his fight for bodily autonomy, religious exemption, and legal reforms to protect individual rights in healthcare settings, with a soft launch offering free chapters and a pre-order available before its October 24th, 2025 release.